Hello friends, today we will discuss about the previous year questions. So here the first question is, in India filariasis is caused by. The options given here are Wucheria bancrofti, Culex, Mansonides and Anopheles. Okay, so here the question they have asked is caused by. So since it is caused by, here the option is A, that is in Wucheria bancrofti. Suppose if they have given transmitted, okay, then you can think of the Culex. So here the location of adult worm usually in the lymphatic tissue, and the microfilaria usually resides in the blood. It has a peculiar nocturnal periodicity, that is, it usually the microfilaria comes out from the lymphatic tissues usually in the night time. So it is a preferred time to take the samples at the night time, that too preferably about 6 to 9 p.m. Okay, so coming for the vector, it is in Culex and Anopheles in the rural Africa. I think this point is not no need. If you remember this Culex, that is more than enough. Okay. So next question is, what negative strain with India ink is used to demonstrate flagella, cell wall, capsule and the spore. Okay. So always the capsule is demonstrated by the negative strain. So here the option is capsule. So negative strain, that is India ink and the nigrosin. Okay. So in this what will happen is the background will be usually black in color, whereas the organism it will be remain unstained, and so that it will be refracted. Okay, and this is mainly useful for the demonstration of the capsules. So always remember the capsule staining is by negative strain, that too India ink and the nigrosin. Okay, coming for the third question. So heat labile liquids can be sterilized by. So here the answer is membrane filters. Okay, and usually see the vaccines, sera, antibiotic, sugar solutions and the body fluids, these usually all are sterilized by the membrane filters. Okay, so coming for fourth question, antibiotic associated colitis is due to Clostridium perfringens, Clostridium botulinum, Clostridium tetani and Clostridium difficile. So always antibiotic associated colitis is associated with difficile only. So that too there was the main antibiotic which have been implicated in causing these conditions are, that is, it is in pseudomembranous colitis, right? So here, so first you want to remember about cephalosporin. In cephalosporin, ceftriaxone, it is the most common cause, and clindamycin, ampicillin and ciprofloxacin, they are also prone to cause the pseudomembranous colitis. And here the one point is peculiar, like vancomycin and metronidazole. They are also implicated in causing this colitis, but they are also given as a drug of choice for the Clostridial difficile infection. Okay. Coming for fifth question. So here the most important lab diagnostic test used to diagnose the enteric fever during the first week. Okay, so here you want to diagnose the typhoid fever during the first week. So options given are here are blood culture, Vidal test, urine culture and the fecal culture. As you know, there is a famous mnemonic called as an BASU, that is B, blood culture in the first week. Vidal test, it is an agglutination test, that is stands for A, and stool culture in the third week, and the urine culture usually it is taken in the fourth week. Okay, so here the answer is blood culture. So again friends, a Vidal test, you want to know what it is a type, it is a tube agglutination test. And what about the values to taken as in positive is for H it is in 100 and for O it is in 200. Okay, so if it is 1:100 and 1:200, then you can give it as a positive for Salmonella typhi infection. Okay, so thank you friends.